So welcome everyone. Thanks for joining for our call tonight. I'm here with MP Paul Manley from Nanaimo-Ladysmith Riding. And tonight we're just going to have a conversation and dive in behind the scenes of Motion 77 for improvements and national standards in long-term care. So welcome, MP Manley. Thank you so much for joining us tonight. I'm not sure if you're on screen unless you speak up for a minute and say hello. So you want to do that?
Yeah, hello everybody. Thanks for joining us and thanks for the invitation to take part in this webinar.
Great, thanks. So I'll get us started with a few housekeeping obligatory notes before we begin here. We've got about 45 minutes planned out tonight. I do hope that we'll have time for a few audience questions at the end. If you'd like to submit a question, I ask that you would use the Q&A function that's usually on the tab at the bottom of your screen. Please don't use the chat for your questions because we don't have capacity to monitor that and pull out questions from there. And I hope that we'll get to some questions. We usually get a lot of them submitted, so I'm sure we won't get to all, but please do submit them and we'll see what we can do. I also want to note that we have live transcript available. So if you want subtitles, you need to turn them on. And so there's a button at the bottom of your screen that says live transcript, and you should be able to turn on subtitles with that. And finally, I just a reminder to keep the comments in the chat respectful and appropriate. We do have the capacity to turn that off, and I hope we won't have to because we want that to be your space to engage with one another as participants. Actually, the final one is that we are recording this webinar, and we're hoping to make the recording available in the next few days. And you can find it either on the BC Health Coalition website or YouTube channel. And we'll also send it out to anyone who registered for the webinar today. So without that takes care of the housekeeping. I'll introduce myself and we'll kind of dive in. My name is Audrey Gay and I organize with the BC Health Coalition. And I want to begin by acknowledging that I'm joining today from the territories of the Musqueam, Squamish, and Tsleil-Waututh nations of the Coast Salish people here in what's colonially known as East Vancouver. And I want to invite all of you to take a moment and reflect on your own relationship to the land where you find yourself and the nations that have been its caretakers since time immemorial. We usually encourage people to post where you're joining in from in the chat. If you'd like to do that, I invite you to do that. So if you're not familiar with the BC Health Coalition, we're a coalition of individuals and organizations that champion a strong public healthcare system in BC that's there for all of us when we need it. We're young people and older adults and healthcare workers and researchers and health policy experts and people with disabilities. And we come from community and labor organizations and together advocate for evidence-based improvements. We stimulate public health education and we drive positive change through our campaigns. So if you're not familiar with us, I encourage you to learn more and reach out. And just as I mentioned that we love public healthcare and we believe in it, I also want to acknowledge that there's a healthy discomfort in the work that we do because we know and are very acutely aware that access to healthcare is not equal, even with Medicare. And so we've heard through the In Plain Sight report, last November now, that anti-Indigenous racism continues to be really persistent in the healthcare system, and so it's a key part of our role as settlers and settler organizations to continue to learn how even our healthcare system is ingrained in colonial legacies, and we benefit from that in a way that others don't across Turtle Island. So I don't want to spend too much time reminding you of all of the horrors that was revealed about the reality of life and work in long-term care during the COVID-19 pandemic. I know most of us who are joining tonight or are watching later have felt that and followed that quite closely. But I'll just say that arguably there's nowhere that we've seen that public health care matters and ongoing investment in public health care matters quite as strongly in long-term care, where we've actually experienced the results of decades of cuts and privatization, and that's resulted in, as I'm sure you know, the highest percentage of COVID-19 deaths in long-term care among our peer OECD nations, as well as multinational corporations that continued putting profit before people and paying out dividends to their shareholders, even as their residents were dying in situations of neglect. So we're here to talk about long-term care and how we can make it better here tonight. And I'm really glad to be here with MP Manley, who is responsible for motion 77. As I've said, it's maybe the technical name for a great motion to reform long-term care and national standards. And it calls for many reforms that advocates have been asking for a really long time. And I know MP Manley was just telling me he listened to a lot of people who have been making those calls for change for a long time. I won't tell you much more about the motion because he knows it much more better than I do. So without further ado, I'll invite MP Manley to come on screen now and share a little bit of context and give us some background for this to get started.
Well, thank you very much, Audrey. I'd like to acknowledge that I'm on the traditional territory of Nanaimo First Nation, and it's a real honor and privilege for me to serve the communities in the unceded territories of Snanawas, Nanaimo-Ladysmith, and Layaxon. I was first elected on May 6th, May 6th of 2019, and before that, I had been working as a filmmaker. I'm a documentary filmmaker, and so I've done a lot of work around healthcare with the Council of Canadians, and I'd been working on a Seniors Connect project, so I was very well connected with seniors here in the community and doing videos with seniors and hearing a lot about what was going on in the community. Shortly after I was elected, I started to hear about the conditions of people living in the long-term care home, the Nanaimo Seniors Village. And I responded, well, this is a provincial issue. There's no federal jurisdiction here. And the response that I got was, actually there is, because Nanaimo Seniors Village is owned by Retirement Concepts, and Retirement Concepts was purchased by Onbang Insurance, a Chinese insurance company, with the permission of the federal government. So a purchase like that by a foreign entity had to be approved by the federal government. So I started to look into what was happening. Onbang Insurance, the CEO had been charged in a corruption scandal, and the Chinese state had taken over Retirement Concepts and Nanaimo Seniors Village. So it's owned by the Chinese state. Many times before, I'd heard about the conditions in these homes and also really about the workers who work in these homes. The Retirement Concepts had been flipped a number of times, and every time that it was sold, the workers were laid off. They were hired back with lower wages, no benefits, and part-time, and really like undermining the rights of the workers and people who had gone to school, who had studied, who had decided that this was a career path for them, and then were just being completely disrespected in a privatized long-term care setting. So at Nanaimo Seniors Village, the average, somebody who was making an average wage of $25 an hour in a not-for-profit or publicly run long-term care home, at Nanaimo Seniors Village, they were making $18 or $19 an hour. So they're having trouble keeping staff on. The staff there were very stressed out because they didn't have the support that they needed to serve the community that they were there working with. And I got reports of, I got a thick binder of somebody whose wife died in that home, and he thinks prematurely, outlining the horrendous conditions in the home. So people were left in soiled beds for long periods of time. They weren't getting their medication when they needed it. The food was really bad. They were just cutting corners all over the place, and it's because staff couldn't keep up. And when I talked to staff there too, they were very stressed out about the situation. So I was bringing this up in the House of Commons, basically saying that foreign corporations, I don't care where they're from, have no business in our healthcare system. Long-term care homes are part of our healthcare system, and the federal government should not have approved the sale of this home to on-bank insurance, and should not be approving any more sales for foreign ownership. And in fact, why are we having private corporations profiting off of seniors who are being warehoused in substandard conditions? And so the next thing I did was go to a town hall that was held here in Nanaimo with the BC Seniors Advocate. And the Seniors Advocate outlined the differential between the care hours that were being provided by not-for-profit and the public system, and the care hours provided by the private system, and the private system was falling very far short. The pay that was being for the workers was, adequate in the public and the not-for-profit system, but it was substandard in the for-profit system. So there was a whole bunch of these things, and the dollars are the same for each person living in long-term care. It doesn't matter whether it's a public, private, for-profit, or not-for-profit home. The dollars per person are the same. But in the for-profit system, they were putting far more money into administration, into real estate, and other things, and less into staffing and less into patient care. Well, then the COVID crisis hit, and we saw what happened. And Canada, had this horrendous situation where we had more deaths in one of the worst records of a OECD country, or Organization of Economic Cooperation and Development, and in our long-term care homes. The situation was deplorable, and in Ontario and Quebec, it was really bad. Luckily, in BC, Nanaimo Seniors Village was taken over by the Vancouver Island Health Authority before the COVID crisis, and we didn't have a serious outbreak here on Vancouver Island. The health authorities took over 3 of these retirement concepts homes. But in Ontario, we just saw, an astronomical number of deaths, completely preventable, completely avoidable. And residents just weren't getting the kind of care they deserved. They had to bring in the army, who were finding, cockroaches and people banging on their walls to get water, to get food. People were malnourished. Their sheets hadn't been changed. They were living, in basically in the filth, and so it was, really deplorable conditions. And so I met with experts. I did a number of town halls and had a number of meetings over this, and heard what they had to say. And that's where I came up with the language for Motion 77, and worked on it with Annie Paul, the leader of the Green Party, whose father died in long-term care during the COVID outbreak. And so it's asking the government to act urgently to deal with long-term care during the crisis, but also to implement some national standards, because we saw, some provinces were really falling down on this. Some provinces were doing a not bad job, but in Ontario and Quebec, obviously, they were doing a terrible job. And we had, large corporations like Chartwell, which happens to have Mike Harris, the former premier of Ontario, on its board, where a large number of deaths were occurring. And when the COVID relief funds came, they paid shareholder bonuses and executive bonuses, and a number of companies did that. This is one of the things that we flagged for the COVID relief programs, that none of that money should go to shareholders and executive bonuses. It should all go towards workers and people who needed the relief. And the long-term care homes were one of the worst examples of profiteering by these corporate entities. So one of the things that was really brought to the fore was the need for national standards, and the need to bring this under either under the Canada Health Act or modeled on the Canada Health Act. And I heard different viewpoints on that, so I chose that it should be modeled after the Canada Health Act, and it should be universally accessible. Staff need to be paid adequately and get proper training. We need to make sure that everybody has proper protective equipment for staff, family, caregivers, residents, and implement a basic care guarantee to increase the number of trained staff in long-term care facilities to ensure a minimum of 4 hours of regulated personal care per day for every resident. And this was the Ontario Nurses Association basic care guarantee when I talked to them about this. And so that doesn't mean it's always going to be a nurse. It means different care professionals, and it's an average over the patients, because some patients need more care than others. Pay staff adequately and provide benefits and paid sick leave, invest in training to support and ongoing professional development and specialization for long-term care workers, support unions to better ensure workers' safety and standards of care for residents and staff, support long-term care home family councils. This is one of the things we heard from people about the fact that some of the family councils are left out of the decision-making processes and really basically shut out by some of these corporations, and ensure that they're included in decision-making and not kept out of the residences unnecessarily. Make long-term care a publicly insured core healthcare service that is accessible and universal. Create a long-term care act modeled after the Canada Health Act that establishes national standards for care and staffing and mechanisms to enforce these standards in all types of residents and facilities. Ensure enforcement of standards of care through accountability and penalties, including criminal prosecution, which is something we should be seeing with the number of deaths in these homes, preventable deaths. There should be some investigation into that, and there should be some prosecution for people that are responsible. And I'm not talking about workers, I'm talking about people at the top who are making these decisions about how care is managed. End private for-profit care and transition the long-term care homes to nonprofit and cooperative management structures and ownership. There is no need for people to be profiting off of seniors in long-term care. And if not-for-profits and cooperatives can do this and provide more care and better standards than for-profit, then it's time to take for-profit out of the system and bring it back into just public and nonprofit care. Increase the proportion of long-term care investment in community and home-based care from 13 to 35% in order to match the OECD average, and work with provinces to support shifting long-term care policy towards innovative community care, such as a natural occurring retirement communities, co-housing models, and enhanced home support programs to allow people to stay in their homes as long as possible. So I tabled this in the House of Commons and asked the Parliamentary Budget Office to cost it out. And what the Parliamentary Budget Office report really shows is that this system has been underfunded to an appalling level. There are 52,000 eligible seniors waiting for beds in long-term care. A lot of those seniors are in hospitals where it's actually costing more money. So there could be cost savings. That cost was $3.1 billion a year. Increase average wages and benefits for per person providing long-term care in the private and non-for-profit sectors by $3.24 an hour, 15% increase to $25 an hour at a cost of $1.1 billion per year. And that's to have parity with the public system. Increase our publicly run facilities, homes. Increase the number of hours of care provided to residents in long-term care facilities each year by 0.95 hours per resident per day at a cost of $4.3 billion each year. And as I said, the seniors advocate pointed out that really it's the not-for-profit or the for-profit homes that are undercutting the number of hours that seniors are getting, and the public sector homes and the not-for-profit homes are actually providing more care than that average 4-hour guarantee that we're asking for. Increase the number of hours of publicly funded home care provided in Canada by 82 million hours at a cost of $5.2 billion per year. So that was a fairly large chunk of the expense, but we know lots of seniors want to be able to age in place. And it's a more affordable way of having seniors care than actual long-term care facilities. And then we've seen polls that show that people are just appalled by how our seniors have been cared for in long-term care, and lots of people don't want to end up in long-term care after watching what's happened in this country. And that's a really sad testament to the situation that we're in. So that's kind of a roundup of what I pulled together, and the PBO numbers on it, and I'm happy to answer questions.
Thank you so much, and congratulations on this, the work that you've put in this motion. It really captures a lot of what we hear and we work on as a coalition when we work with both the workers that work in the homes and family councils and residents and seniors organizations. So really great work, and thanks for getting us caught up to speed. I've prepared a few questions, and they really kind of fall under three categories. So I'll ask you first of all about a little bit more about quality of life, quality of care, and work. So I've got a few questions about this, and these questions are really about like what it looks like on the ground for the seniors, the workers, the family members who we hope will benefit from national standards. And I'll start actually with home care, which you were just speaking about. That's actually one of the most encouraging parts of the motion for myself and other folks I've spoken to, because the PBO report actually includes funding for home support, even in a long-term care motion, and I think that really reflects this belief that they've been siloed systems for so long to great detriment with sometimes wages most often wages aren't equal between community home support and long-term care, which drains workers out of home support into long-term care. We also know there's a lot of privatization in the home support system, so there's a whole other bag of worms. But really, we know that loved ones are being caregivers for their family members at home, and they don't have the supports that they need to do that well, and are very often experiencing burnout and need that support that extra hours and extra funding for home support would do. So I want to ask you how in your vision does national standards help in integrating home support system and long-term care system? Can we create standards and as you say, the Long-Term Care Act that helps to bring those two more in line and have a more integrated system? And what does that look like?
Well, I think if you set up standardization for training, that would be the first thing, so people can move back and forth. We also have a problem in this country where certification in one province doesn't give you certification in another province for a lot of different fields. I'm not exactly sure how that works in long-term care for moving from province to province. A lot of things to deal with this motion would have to be hammered out by experts in a panel of people that really understand the system, because I'm a politician now. I was a filmmaker before. So it's not my bailiwick to determine exactly how it would all break down. But what I foresee is a process of consultation where you bring together all of the different stakeholders to work out how you would develop national standards and setting up a system so the province sign on to them.
Great, thanks. I'll ask you a little bit more about family and resident councils, which is also included in the motion. And one of the positions that we've had at the BC Health Coalition is that we've been asking for the recommendation of the seniors advocate, actually, that we'll have a provincial association of family councils, so that there's that support for resident level family councils, and also that amplified voice when family councils advocate together. So that's one idea that we have for how we can ensure that family councils and we also advocate for resident councils have their voices integrated into decision making. Can I ask you a bit about how you envision that ensuring that they have a voice, or what do you think about a provincial association, or those kinds of structures?
Well, I think a provincial association sounds like a really good idea. I mean, again, you're getting into those kind of details where I would really want to hear from people with lived experience. How have the family councils worked? What is not working? How would you fix these things? And I think that a provincial association actually gives power to the regional or the local associations, so that there is a body that can help to advocate for a local council with a local long-term care home. So,
yeah. Great. Well, we'll keep pushing for that. I'll ask a little bit about one of the interesting pieces. There's I kind of caught a discrepancy between the text in the motion and the PBO report, and it has to do with the mention of for-profit care homes. So the motion calls for the end of for-profit care homes, but there's no estimate about what it will take as a financial commitment to make that happen. So can I ask you to comment a little bit of that, speculate about why that's not integrated in costing, and just I think it's such an important part of informing long-term care. And so what do you think it takes to make it happen?
Yeah, I'm not sure why that was left out of the costing, and I think it's going to be a transition. It's going to take a little bit of time, because we do have a lot of long-term care homes that are for-profit homes, and big corporations that are running them. So there's going to be a lot of resistance to eliminating this profit center for these corporations. And we see like real estate investment trusts are invested into long-term care homes and are calling them great avenues for making profits, because there's a supply and demand issue related to this as well. And the PBO report said that there's 52,000 people waiting. So if we're going to have homes built for those 52,000 people, those homes should be for the not-for-profit, public or cooperative sectors. Let's not be putting money into any more for-profit homes. The contracts with the province are obviously for on a per person basis. So a for-profit, not-for-profit, or public facility gets the same amount of money for a senior living in a facility. But as we build out, I think we just need to make sure that we're not investing more money into the for-profit sector. And I think maybe like that is where the that figure increase the number of beds, the 3.1 billion, that involves building. That's going to be involving the construction of infrastructure, and the first step to eliminating the for-profit model is to make sure that infrastructure money goes into the not-for-profit, public and cooperative sectors.
Yeah. Well, it's a good start. So I'll move on now to some questions that are a bit more about the role of governments and accountability and enforcement, and I think it gets into the kind of the nitty-gritty of how, and I know it gets complex, but I think it's so important that we have imagination about what the role of our government is for this. So I'm curious how you can help us understand. But I'll start with an easy one, hopefully. 13.7 billion is the total cost estimate annually, in addition to what governments already spend. That's from federal and territorial and provincial governments. And you mentioned that's how much we're currently underspending and undervaluing, or it's like and I think it's almost a double of spending. So we're actually spending half of what our seniors deserve on them. So I've heard in the media kind of that many are dismissing the 13.7 as like this astronomical, never achievable figure. And my question for you to start is, can you put that into context for us as someone who's probably seen more federal budgets than most of us? What would be a comparable budget item for federal government, and how big of a sum is that in context?
Well, the federal health transfers are $43 billion a year. But to give you an idea of some government spending, we're going to spend $18 billion on fighter jets. And over the lifetime of those jets, it's going to cost us $60 billion. So $78 billion on fighter jets. F-35 fighter jets is what they're kind of looking at, which are a tool of war and aggression, because they're not really defensive. And we haven't used our fighter fleet really so much for defending Canada as to go and get involved in NATO missions elsewhere. So there's a great place to reallocate some money. But yeah, we saw how much went out with the COVID spending, to help people. And I think that when we talk about having seniors in hospitals taking up beds in hospitals, there is a cost to that as well. There's a cost to seniors not getting the care that they need, and that is borne by our healthcare system in other ways. So I think people say, well, that's an astronomical number. It is. It's a hugely underfunded sector of our healthcare system, and we need to fix it. And that requires spending. Seniors who have paid their taxes, served their country, done their, everything they were supposed to do, should not be living in these kind of horrendous situations. And there's just no excuse for it. So we should find the money from one place or another. Lots of places, including like wealth taxes and closing loopholes that allow people to offshore wealth and avoid taxes. And yeah, a long list of places where we could find cash to do this. Yeah.
Right, and just more on the funding piece. One of the mysteries for me of the PBO report is that it kind of makes this estimates, and then very quickly at the end says that most of this cost is going to be borne by the provinces. So can you explain why that conclusion is drawn? And you spoke earlier about the need for federal involvement, and we know through polling that Canadians support federal involvement. And so what's the financial commitment for the federal government? And can you explain why the report claims that that cost would be borne by the provinces and not the federal government?
Well, the costs, the federal government is one of the main taxation bodies, the main taxation body in the country. So a lot of this goes out through transfers to the provinces, and what we need is national standards that tie those transfers to accountability and to meeting targets. And so that's how you set up the system. We have to work with the provinces on this, but the federal government collects taxes and then divides that out to the provinces. The provinces collect their own taxes as well, but when the PBO says that the costs are going to be borne by the provinces, it means that a good chunk of that money is still coming from the federal government, and the federal government may need to put more into the transfers to do this. And actually, the federal government has fallen down on the health transfers and needs to increase the amount of money that's transferred for healthcare, and that became very apparent during COVID as well. So the federal government should be transferring more money and then just tying those transfers to care commitments to ensure that the money is well spent and that there's transparency and it goes where it has been earmarked to go.
Great. So I'm going to choose just maybe 3 more questions, and then hope we have some time for some questions from the audience. Um, so motion 77 also calls for enforcement of standards through accountability and penalties, including criminal prosecution. Can you say more about how national standards can make use of enforcement, accountability, and penalties? And I'll just add as some context, you spoke about this in your opening, that in BC, we've seen that both provincial licensing and accreditation, haven't always been effective at ensuring certain quality of life standards inside the homes. And you're well familiar with the case of the private homes that were put under health authority administration. They were all accredited within a month of that happening, a month prior, and they were all licensed by the province and have contracts with the province. And so yeah, how do national standards help to address those current accountability mechanisms, and mostly how they're not working? And I just saw quickly, I'll incorporate this. There was an audience question around the contracts that provincial governments or health authorities have with facilities. That could be an extra layer of accountability. So that's I just said a lot of things, threw a lot at you at once, but just I guess my question is just generally, can you comment on how we enforce standards and have accountability, and what's the role of penalties in that?
Yeah, so the system obviously isn't working, and this was apparent in Ontario as well, where inspections were carried out, or there wasn't enough inspectors, or the homes weren't being inspected properly. And so we need a system that actually has more accountability built into it. And that's where you have to embed these things in national standards. In terms of penalties, like when people are dying in these homes during an outbreak, and it's because they're substandard conditions, well, then who's responsible for that? The management of the homes. And it comes right down to the executive and the board of directors, and they should be accountable for the deaths in those homes and for the conditions that people have had to live in. So if we have a set of standards and homes can't meet those standards, then part of that accountability should be like what happened here in Nanaimo with Vancouver Island Health Authority taking over the home and taking over the licensing of that home. So we need stronger accountability, and we need to have some kind of system that has teeth to it. Otherwise, we can have scofflaws that ignore what they're supposed to be doing and don't follow through properly on inspections or meeting standards.
Yeah, great. So for the sake of time, I'm going to move us to, I just have a couple of questions, and these are more for our sake of about how we build public support. And my first question on this point is I'm curious about how you found, what ways you found that effectively can help differentiate between the kind of crisis, immediate COVID-19 moment that we're in and the deaths that brought on, but then the longer term systemic issues that were already at play before that, and will continue to be at play even once seniors are vaccinated. I think there was a moment where maybe people forgot about long-term care because the vaccination campaigns were kind of all done with, and we saw outbreaks decrease. Now we're back to 6 outbreaks in BC. But yeah, just do you have any tips for how to best help the public differentiate between the current crisis and then the longer term systemic issue?
Yeah, I think that the current crisis really showed what the long-term systemic issues are. And I think that the pressure has to be kept on government, and that advocates, family members, seniors in long-term care, the workers need to continue to press on these things. So the unions, the workers, and everybody that's affected by it. And, like I was highlighting that poll that was put out earlier this week, showing that people don't want to be going to these homes. So they're worried about their loved ones going into homes. They're worried about their senior years and whether they would have to end up being in a long-term care facility where they're basically warehoused for profit. So I think it's really incumbent on organizations like the BC Health Coalition to continue to put pressure, talk to the MLAs, talk to the MPs. If we're having an election coming up, which it looks like, then this needs to be an issue, and it needs to be pushed by everybody that's got a stake in it. And we all have a stake in it because we all get old. And so, whether it's long-term care or home care, we're going to need care at some point in our lives. And if we need to prioritize this in order to make sure that people are cared for properly.
Right, and you actually answered my last question. I was going to ask you, what do we do as individuals and as a health coalition to help keep this going? And so I'll just leave it at that then for me. And we just have a few minutes before we're on time here. But I see one question from the audience that's really important and quite easy. And I forgot to ask, what is the status of motion 77?
Well, it's sitting right now. If there's an election, it will die on the order paper. So that's I tabled it really to push the envelope and to push the discussion to just get it out in front of the public about what needs to happen. So that's the key reason for doing that. And then if the there's an opportunity for a unanimous consent motion in the House of Commons, I'll try to do that. It would have to be less specific because often unanimous consent, it just takes one MP to say no and it's done. So.
Okay. Well, thanks, and thanks again for all that hard work. I think, unfortunately, we're too close to time to dive into another question. So I apologize to participants that we didn't get to many of your questions. I want to thank you again, MP Manley, for making time to be with us today. And I'll let you have the closing words. So, any final remarks to leave us off with?
Yeah, just that continue on with the advocacy. I think that our seniors deserve far better, and we need accountability in the system. We need to have a care guarantee to make sure that people living in these homes, and they are homes. These aren't facilities or institutions. These are people's homes where they're spending the last years of their lives. They need to be living those last years in dignity, in a way that the workers feel good about what they're doing, the family members feel good about how their loved ones are being treated, and the seniors living in these facilities, in these homes, are enjoying the final years of their lives.
Well, thank you so much. And so I think with that, we'll wrap this event up, and I'll thank you again and your team for helping us put this event together, and really our commitment to both you and everyone who's tuned in today is as a coalition, we really truly are going to keep pushing until we see national standards, and we see that improving long-term care is both provincial level and also federal level. So stay tuned, and I'm sure you'll hear more from us during what we expect will be a very soon election. So with that, I'll bid everyone a pleasant evening.
Thank you very much, Audrey.
Thanks.
Have a great evening, everybody.